Okay.
Same.
He has been allotted a couple of
Shirish sir, can you hear me? आवाज नहीं ऑन हेलो हेलो Shirish sir, can you hear me?
Yes, madam.
Yes, we are going. I will give a brief history of this case. This is a 73-year-old male, ASA 2, controlled uncontrolled hypertension. Hello.
Yes,
This is a 73-year-old male, ASA 2 patient. He is a known hypertensive on tablet atenolol 50 mg OD. No other comorbidities. Airway spine is normal. He is NBM since 6 hours. Consent has been taken. We will be demonstrating. He is posted for intertrochanteric fracture right side for right-sided proximal femoral nailing. So we will be demonstrating fasciolata block right-sided before giving then he will be turned in the left lateral position and then continuous spinal anesthesia will be demonstrated.
Okay.
Now sir will describe the procedure while performing the block.
Hello.
Yes, sir.
This is 0.25% levoanamine. I have taken from the same vial, and this is 2 ml of isobaric levopiravir from the same vial. Then again I will describe you. This is for block, which I will be demonstrating now, and after that we will be giving continuous spinal with epidural current.
Yes.
This is how I will just bend the tip of the needle. The landmarks for relaxed spine. Measure the distance, lateral 1/3 and medial 2/3, and just go to 2.5 centimeters below that. This is anterior superior relaxed spine. This is pubic tubercle.
Yes, sir.
Can you see?
Yes, sir.
This is medial 2/3, lateral 1/3.
Okay.
I will go just 2 to 2.5 centimeters below that. For security reason, just palpate whether femoral artery is there. At times can be little bit disturbed. So femoral artery is way aside. एक सुई लगे. This is first resistance. Can you see?
Yes, sir.
This is first pop. I have passed.
Yes.
And then this is second. That's done.
Okay.
Okay.
Yes.
Now I will inject the. Usually lignocaine is taken for immediate effect, but we are utilizing the vial of 0.5% levopiravir to the full extent. Just aspirate in between. Can you see the backflow?
Yes, sir.
Okay.
Yes.
We can actually demonstrate with ultrasound. We have that, but as we have already late, just by landmark guidance.
Okay.
Okay. दो मिनट चलो. टेबल उठा. थोड़ा work on. As the operative side is up. Hello. First open the line. Operative side is up. We will demonstrate with isobaric drug. If the operative side would have been down, we would have demonstrated it with hyperbaric drug.
Okay.
The isobaric drugs, they are on the verge of being hypobaric. So by the time we fix the catheter, the patient will have unilateral block, mostly unilateral, with volume of just 1 ml. Now I will show you the dead space of this epidural catheter, which we are using for continuous spinal. You have to take into account the dead space of the catheter for continuous spinal.
Yes, sir.
It is roughly around 1 ml. You can see I have taken 2 ml of this, and
Yes, sir.
I am pushing the drug. You will see that after 1 ml it will come there. Just 1 ml. You can see this is the total dead space you have to take into account, because whenever we inject the drug through this epidural catheter, 1 ml will remain inside the catheter.
Yes, sir.
Okay. Now this drug will be washed out when we insert the catheter, so no need to worry during the first insertion, when you give the first dose. I'll clean and drape. अभी दर्द कम नहीं हुआ क्या चाचा? कम हो गया ना? हाँ, फिर अभी शांति से रहो. अभी पूरा बंद हो जाएगा. He has some pain relief. He is lying down comfortably now for spinal. This technique is very important when you get accidental dural puncture during epidurals.
Yes, sir. Yes.
This can be time saving or life saving for the patient, and it can avoid your PDPH if you keep the catheter for 24 hours.
Okay, sir.
Because there is always a chance of second time ADP when you put a catheter at different space. So it is always better that you convert it to continuous spinal.
Yes, sir.
This you need to have some strict aseptic precautions. This is L4, L5. I will go L2, L3, or these are few spines. So I will go at L2, L3. First give local anesthesia.
Yes, sir.
चाचा एक सुई लगेगी. 1, 2, 3, 4, 5, and this 3. It is 8 centimeters long.
Yes, sir.
Can you see?
No, yes. 8 centimeter.
Huh? You have to measure the distance you have entered inside, and you have to keep the catheters only 2 to 3 centimeters inside the interthecal space, not more than that. Okay. Now I am doing it in epidural needle. Just like your routine spinal. But sometimes it's difficult to puncture the dura with this epidural needle because of the metal block. This is, I think I am in the epidural space now. Now I am inside the. You have to just block the CSF with thumb.
Yeah.
Hold the catheter. Tip, tip. We have entered about 1, 2, 3,
5 centimeter.
5 centimeters inside.
Yeah. Yes, we have to give spinal with epidural needle.
Yes. There may be some paresthesia during insertion. I am already on 15 centimeter mark. Okay.
Okay. There is another kit also na?
Yeah,
For
it's not
continuous
available.
spinal. Okay. It's costly also.
Remove the epidural needle. You have to just test it by gravity. That CSF is coming. You can see here
Yes, sir.
3 drops of CSF.
Can you focus, sir?
Just focus on this.
Yeah, sir.
See,
Yeah, yeah.
drop of CSF is coming.
Yes, sir.
That means it is inside.
Yes.
Now fix it to the filter and see. Now what I will do is, this is only 1 ml remaining.
Okay.
So I will give 1 ml first and then again 1 ml, so that 1 ml remains inside the catheter and 1 ml will be given to the patient only.
Okay.
This is 1 ml. एक लड़की का 2 ml से दिया होगा. Aspirate. There is free flow and then slowly inject. By the time you fix the catheter, the effect will be there. It being a isobaric, on the verge of being hypobaric, the patient will have only effect on non-dependent side. When you increase the dose, patient will have bilateral effects.
Yes, sir.
1 ml was given, again 1 ml will be given. That 1 ml will remain in the dead space. When you give the next dose, you have to take into account that dead space. No air should go inside. Take the precaution.
Every time we have to calculate the dead space, every time whenever we inject.
And you can just see the levels achieved after 5 minutes and give 0.5 ml of the top up, that is 2.5 milligram of Drpdmmc. And then every 45 to 50 minutes.
Okay, sir.
Okay. Now we will fix the catheter.
Oh, what extra precaution should we have to take for fixation of this continuous spinal other than epidural catheter?
One thing is you have to level it strictly. So
Okay.
that it should not be misused.
Okay.
precautions.
Yes.
चाचा ऊपर का दर्द कम हुआ? कम हो रहा ना पूरा?
Operating leg is on upper side.
Yes. And we have given only 1 ml right now. After fixing the catheter. नहीं मधून डबल करून मधून.
Can we use this catheter for post-operative analgesia for 2 to 3 days?
You have to keep this catheter in place only for 24 hours.
Okay.
Not more than that, not less than that. Because there are chances of infection if you
Okay.
keep the catheter for a long time.
Okay.
And if you keep the catheter for less than 24 hours,